So I want to talk about the leg now and the foot. And before I talk about the leg, I'm going to reiterate something on the pelvis. So on the pelvis, we had the ilium, we had the ischium, and then we had the pubis. We also had this really large socket. Remember that your pelvis and your hip is going to be that ball and socket joint. So we have the ball of the femur here is going to fit into that socket. That socket is called the acetabulum. And if you think about it, you're sitting here, so that's your butt. So your acetabulum is close to your fill in the blank. And so that's basically one of the ways to remember that is that socket is called the acetabulum on the pelvis. So we have basically 4 bones in our lower leg or in our leg, and then we've got the foot. So I want to talk about the 3 bones. So the first thing that you'll notice is when I'm doing this video, these bones take up a lot more space than these did. So big thing here is arm versus leg. The leg bones are going to be much, much larger, and I'll do a video that showcases kind of the difference between them even further. But the first thing is the femur. So this ball here is the part of the ball and socket. So this is the upper leg. And then the lower leg is going to be these 2 bones here. And the way that it is your femur is going to transmit weight down to your lower leg. So if you're talking about weight bearing, you're going to want the thicker one to bear that weight. So this one here is called the tibia. The easiest way to remember that is if you look at the top of the tibia, it looks like a T. So that's the tibia, and this one here is the fibula. The fibula is the little thinner one. It's basically used for muscle attachment, and it's used for stabilization. So your femur is in your thigh, your tibia and your fibula are going to be in your leg. Tibia is going to be medial, fibula is going to be lateral. In between your femur and your tibia, which is basically going to look like this, we've also got the kneecap. The fancy word for the kneecap is the patella. So that's the patella there. So from our leg, we're then going to go into our foot. And our foot is actually very, very similar to our hand. So this time, instead of having carpals, we're going to have tarsals. What's the best way to remember that? Carpal tunnel, issues with your wrist. Tarsals are close to your toes. So your tarsals are all of these small bones that make up your ankle. Then we have the metatarsals and the phalanges. So essentially, we had carpals and metacarpals in our hand, and we have tarsals and metatarsals in our foot. And then all of the finger bones, all of the toe bones are called phalanges. So the same way that we numbered our hand, we're going to number the foot. We're going to start with our big toe. That's digit number 1. Go to our second toe, digit number 2, 3, 4, and our 5th one is our small toe. So when we talk about these, same thing, we have 5 metatarsals, and then the phalanges, remember how in the thumb we only had 2? Well, in our big toe, we only have 2 as well. Every other toe has 3 different phalanges. The only one that has 2 is our big toe. So essentially our thumb and our big toe are going to be similar in the fact that they only have 2 phalanges.